Hello guys, welcome back. My name is Microbiology 254. So today I'm so tired, but I have to do something for you because I find something very interesting, and most of my friends have requested me to do this. So I'm gonna talk about the UTIs. Maybe in one or the other you've heard about the UTIs. Just very common to me and to you. So I'm gonna talk about the UTIs. So generally, what is a UTI? UTI is just a urinary tract infection. That is the UTI is a short form of the urinary tract infection, and these are the infections that are affecting urinary system. Those are the UTIs. So this infection affecting the urinary system uh, causes maybe discomfort. You're causing it causes discomfort and also causes pain at the lower back of our abdomen. So we usually go for check of the UTIs because it is very common, and also it's very common to ladies because I'll give you the reason why it is common to ladies. So UTIs are usually caused by the bacteria or the yeast. So this bacteria finds a way that they enter through the urethra, then they enter through to the bladder. Once they enter to the bladder, that's why you feel that there's a lot of pain at the lower abdomen. So when these infections they are not treated, when these UTI are not treated, or they cannot get proper treatment, they can lead to kidney failure or they can lead to kidney damage. So it is important you go and check up for the UTIs, and also it is very, very important you go and treat UTIs. If you feel any uncomfortable sign, one of the signs of these UTIs, it causes a burning. You feel some pain during peeing. It causes burning, of course, during urination, and also it causes discomfort, and also it causes a lower back pain, and also it can lead to blockage of the urethra, because the kidney stones can lead to blockage of this urethra, and when there is a blockage in this urethra, it can lead to what? Kidney failure. So it is very important to go and do or treat the UTI. So why do we do the UTI treatment? Or why do you do the diagnosis for the UTI? UTI, there are a couple of things that we usually go in the lab or do for us to understand which type of the drug can be used to treat these UTIs. So when you find we find some of these symptoms, like the burning, you have the lower back pains, you have burning during, you feel like you're burning during your urination, or you're feeling pain at the lower abdomen. So you just go to the hospital for the checkup. So that's why we usually do a urinalysis test. That is urine analysis test. For the urine analysis test, we usually go and check. There's a couple of things we usually do with it, because we have two things. We have the urinalysis part and we have the culture part. So culture and the sensitivity. So under urinalysis, the doctor usually requests you just go and collect the urine and go for the urinalysis. So when the urine is brought to the lab, we usually do different things with that urine. First of all, as medical lab, we usually do urine analysis and urine processing. So under urine processing, we usually do three things under urine processing. There's a pre-analytic method, a step, analytic and post-analytic. There's a pre-analytic, analytic, and post-analytic. Pre-analytic, that's we usually check the labeling of the sample, the amount of the sample, the volume, and under analytic, that's where processing of the urine comes in, and a post-analytic down under the result part. So under analytic part, we usually for urinalysis, we usually do a macroscopic part, biochemistry part, and a microscopic part. Macroscopic part, that is the physical. We usually check for the physical appearance of the urine, the color, the color, the odor, that is the smell, and usually we check for the clarity. Under the biochemistry part, that's why I usually do the urine strip, that is the urine dip strip, where we usually check for the ketones, we usually check for the proteins, we usually check for the glucose, we usually check for the pH, the SG, the urobilinogen, the bilirubin, We usually do for ketones. That's under biochemistry. And also we usually go for the the microscopic part, where that is the last step, whereby under microscopic part, you usually check for the presence of the RBCs in the microscope under the deposit. Usually place the deposit in a slide, then we go and check it microscopically to check for the presence of the RBCs, the parcels. We have the casts and we have the crystals, and also we usually check for these bacteria. We have the Trichomonas vaginalis. We have that's one of the bacteria, one of the microorganisms under the deposits, and also we usually check for the yeasts. So that is under the urine analysis. Then the second part, we have the culture, whereby we usually do a culture test, where it usually takes a 3 day, or it can go 3 is just the minimum, but it can go up to 4 days, 5 days, depending on which pathogen or which bacteria are you isolating. So under the culture part, we usually do usually request the patient to collect early morning urine, and it should supposed to be a midstream or a middle catch. This why do we request a morning urine? Because this morning urine, usually the concentration of bacteria is very high. You know when you're collecting the day random urine during the day, there is a high chances you can miss that bacteria, because the concentration of bacteria is low, because maybe you've taken a lot of water, so the dilution has been done in the system. So these bacteria tend to do what? To wash away. That's why we usually request for the morning urine. So whenever you ask to collect a morning urine, don't question the doctor, or don't question the medical lab or the lab technologist why he or she requesting you for the morning urine, because it's very important. So it's also supposed to be a middle catch. The first you pee the first urine, then you collect the middle catch, then you cover the top of that container, then you finish peeing. That is the last drop. So you collect the urine to the lab, and therefore under the lab we usually do, that is where microbiologists come from, we usually do culture and inoculation, whereby we usually inoculate this urine in Kled and the McConkey on CBA, that is usually do inoculation. Then we usually do what we call the biochemical test to identify which type of bacteria is that present in that sample. After that, we usually do what we call the drug sensitive test, because this drug sensitivity test help the doctor to do selection of the drugs that can use to treat these UTI. So that's under the lab part. After due sensitivity, we take the result back to the patient or the doctor. Then the doctor will do selection of the drugs. So the main reason why the doctor usually requests for these tests, usually just to monitor the condition of the chronic diseases like the kidney stones, just monitoring the condition of the chronic diseases, and also medical diagnosis. The second reason is just for medical diagnosis. It's very important for medical diagnosis. And of course, I've told you about the proper selection of the drug, helps the doctor for the proper selection of the drug, and also for the treatment of this recurrent UTI, just for the treatment of this recurrent UTI. Also for the routine management and screening. So that is the reason why we usually do this the urine culture and analysis during urine culture sensitivity analysis. So what are the effective prevention tips that you can do? Ensure proper hydration. Just take a lot of water. It reduces this kind of infection, the UTIs can reduce probably at a certain percentage of this UTI. So this is another one for ladies. I know you know, wipe from front to back. I know what I'm talking. Hope the message is clear. Wipe from the front to the back. Ensure that when you are cleaning yourself, you wipe from the front to the back to prevent that infection from being transfer or from one place to another. And also ensure urination after sex. I know this one is very funny, because it helps us to empty your bladder. By emptying your bladder, it reduces this kind of because the pH of the urine is very high, can cause the heating of the wall, that the damage of the walls, that is. So ensure emptying yourself or your bladder after sex. Alafu, then avoid irritants. Some of these irritants, of these chemicals, they're very irritants. Maybe you're using the lubricants, maybe you're using, yeah, lubricants, maybe you're using this material for yourself satisfactories. So these, they can cause UTIs because they cause corrosion in the walls of of the of the urethra. So I've just told you these UTIs is very common to ladies. That's why ladies are very prone than men because their reproductive part can able to accumulate these bacteria, and they can strive well because of the temperature as very warm. And also we have the common microorganisms like the lactobacillus. This when these bacteria find a way that they find the walls, they have found the walls are damaged, maybe during sexual activities. These bacteria, the lactobacillus, that is the normofloras, they usually cause some of these UTIs. So they find a way, they enter through the skin, then they start causing this kind of UTIs. So ensure, ladies, stay safe and make sure you are always clean. So it will reduce some of this infection. So, and also during this treatment of the UTIs, ensure you're not having sexual intercourse, because you cannot treat an infection while you're having sex. It's like you're doing zero work because you continue damaging these walls. So you're supposed to wait for these walls or finish the treatment so as you can be able to continue with your enjoyment. So thank you, thank you. I hope somebody has understand something about the UTIs. So whenever you ask to go and check out for the UTIs, you just go and get proper treatment so that you can be able to enjoy your life the way you want. Thank you. That's all. My name is Microbiologist254. Make sure you like. There's my channel there on YouTube at Microbiologist254. There are more tips like this. And also in Facebook, I have my channel there at Microbiologist254. And also in TikTok here, Microbiologist254. Instagram, Microbiologist254. Thank you. Thank you, guys.